so it's been 13 days since my ACDF fusion surgery in my cervical spine, 3 levels, and tomorrow will be officially 2 weeks since my surgery. So we're about to head out to the surgeon's office. We'll see what the surgeon has to say, ask him a lot of questions, and I'll give you an update once we get back. Thanks.
We're here at the Virginia Spine Institute. This is where Chris is going to have her appointment this morning. These fine doctors here have been the ones that have performed her surgery. They did a great job. I had to put my mask on. Now we're going to go inside. Chris is being seen on the 8th floor. Yes. All right, someone got off on level 2. We're going to go up to the 8th floor. Turn left, and here's reception. All right, we're in the room up here on the 8th floor. We're about to be seen by the doctor. How you feeling, Chris?
I'm feeling pretty good. I'm just mild aches here and there, and looking forward to seeing what the x-rays show.
Let's check out from the 8th floor.
All right, so we just got back from the surgeon's office, and everything went really well. The surgeon says that everything looks great, looking at the x-rays post-op. The hardware and screws, along with the artificial disc and the fusion plate, are all in place, looking really good, and looking forward to seeing how that progresses over the next 3 months. And then we'll take another x-ray 3 months post-surgery, so in April, to take a look at the hardware and the fusion plate and see if we can hopefully see more bone fusion occurring within the plate and the 2 vertebrae at C5, C6. Part of today's post-op visit was an opportunity for me to ask a lot of questions of the surgeon. Things like, is it okay to take calcium supplements at this point? He did say yes, it's good to go ahead and do calcium supplements. Make sure I'm also doing vitamin D as well. I asked questions about MRI machines, is anything magnetic in the hardware? They did say that there is some metal in the hardware, and just to make sure that when you have an MRI done, to talk to the technician to make sure they understand the type of instrumentation you have within your spine. Some of the other things we talked about were the swelling that I was feeling when swallowing. So the pain is gone. That was gone a couple days after surgery when swallowing. And again, thanks to the popsicles. But some of the other issues I'm having is just like a narrowing feeling. Just feels swollen and tight in the neck area internally. The doctor said that a lot of that is due to the inflammation, and that should go down over time. And the good news is that it has been getting better. It feels less awkward to drink fluids like it did a few days ago. So things overall are progressing well and getting better in the swallowing department within the throat. The doctor did say that there was a little bit of scar tissue he could feel, a little mass in the throat area just above the incision internally. And he said that I could lightly massage that mass, and it should help go down. It should help also with the swallowing in the next few days or so. The other thing we talked about was physical therapy. I did get an order for that today, so I can go start physical therapy as soon as I can find a location and get an appointment made. And they listed out all the things that they would like done, and then made sure the restrictions were in there as well with the BLTs, no bending, lifting, twisting, and no traction either because of the artificial disc infusion. So that was important. So it'd be great to get to physical therapy and start to strengthen the area, the muscles in the neck region and the shoulders area. Aside from physical therapy, the doctor and I also talked about when it's right to go back to work. So he'll typically ask you, like he did me, he asked what type of work I do. Most of my work is sitting at a desk typing, looking at monitors and things like that. So a desk job basically, which helps because that means I can return a little earlier than other folks may be able to. We talked about maybe doing part-time or waiting another week or 2 and going back full-time. So we decided to wait another week or 2 and go back full-time. And then that way I can start getting in some physical therapy now to start strengthening and getting back to a normal routine over the next 2 weeks. To slowly ease back into the workforce and not go all at once or too much too soon and risk having to come back home and go back on short-term disability or take more time off from work. So over the next 2 weeks, what I'll be doing is going to physical therapy, doing some home exercises and stretching as well, whatever exercises they provide for me, and I'll make sure to include that in a later video. But more importantly, just be good to kind of slowly get back to a normal routine here at the house, get in the car and drive. I haven't driven in 2 weeks, so I thought about getting in the car and driving around the neighborhood in kind of a safer environment so that I can do, you know, the twisting and rotating up and down and sideways to make sure I can see out the mirrors and to make sure that I can make lane changes and things like that in more of a safe environment here in the neighborhood, and then feel more comfortable going out. And it's almost like learning to drive again in a weird way. I know it sounds crazy, but when you've had this kind of surgery and you've been resting for a couple of weeks and you're unsure of what to do and movements to make, the doctor basically calls it social head turns. So basically socially moving your head left and moving your head right. You shouldn't make quick full motion turns left and right. It should be more controlled social left and right and up and down, nodding your head yes and no, things like that. Nothing crazy and quick that could hurt your fusion or be painful. So those are a lot of things we talked about today. Again, the doctor was very happy to see the progression I've made so far. After 13 days, he was pleasantly surprised to hear I was off of pain meds after day 3, so it can be done. I do ache sometimes more than others, but it is thankfully managed by over-the-counter Tylenol, 500 milligrams. Has been very helpful. I usually take one in the morning and one at night. And I have been doing a muscle relaxer at night, very low dosage, just to help me sleep at night and get comfortable in the bed. But I foresee pretty soon being able to not have to do that anymore either. The other thing I'll mention is that I did find some really great pillows on Amazon, and I've done a separate video on YouTube for that, an unboxing. Hopefully those videos will be helpful to you as well. Within this video, we'll also take a look at my x-rays so you can see or get a look at the artificial discs at the 2 levels, C3-4 and C4-5, and then look at the fusion plate and the titanium cage within C5, C6. I think it'd be good for folks to be able to kind of see what it looks like and get a visual of what would be inside of your spine if you do have that type of multi-level surgery. You may have also noticed in this video that the stera strips are gone from my surgical site in my incision area. Those came off about 3-4 days ago, and it's actually been really great mentally as well as physically. You don't feel that tugging of the stera strips, and the incision is pretty well closed. It's healing really nicely, so that was the other confidence level that it was okay for them to come off. But mentally it was really great to have them come off because it almost felt like a step forward in the healing process, where I wasn't staring at this bandage or this gauze. It was actually, okay, there's the incision, it's closed, it's healing, and it was just a really good mental boost because let's face it, I mean, this type of surgery, very extensive, it can really get a person down, especially coming out of anesthesia. People don't talk about that a lot, that it actually does affect your mood and your mindset, and it can alter your mood and your mindset at times and make you feel regret or sadness or despair, just many of those different things that you can feel. You can feel isolated or alone and just sad. It's important to reach out to people when you're feeling that way. I tend to internalize, and I quickly realized that that was the wrong way to go about that. I just felt worse doing that. So I had several really great friends I could reach out to, along with my husband, who just let me sit and talk sometimes, talk out the crazy, if you will. If you'd asked me a week ago if I regretted the surgery, I would have said no, but I would have hesitated because I just wasn't sure. I wasn't sure if this was how I was supposed to feel, if it was going to feel any better. It was just not a good time. Today, I can tell you I absolutely do not regret the surgery. I am very pleased with my progress so far, and I can't imagine having not done it now, considering how much pain I was feeling and all the numbness and everything in the arms. I'm feeling none of that, just mild aching, which is expected. And I can tell you for sure that this was the right choice for me. Obviously, it's important for everyone to evaluate their own choices, but I can tell you from my perspective, my experience, I'm really glad that I made this decision, and I'm definitely feeling and seeing the results in a good way. So I hope to do another update in a few days. Again, this is day 13, so maybe before we hit the 3-week mark, I'll do another update and talk about how I'm doing driving and kind of getting back my independence. I think that's the next mental step for me, someone who's very independent, who likes to be able to do things on their own. I think that's just the next growth step I need towards recovery and feeling whole again. So thanks so much for watching, and don't forget to hit the like button and subscribe.
All right, they performed the x-ray, and here's Chris's skull and everything.